Ellie. I am so excited to go to this interview with Dr. Vaughn to get the inside scoop on what your family doctor or what your doctor wants you to do to become healthier.
Yes, let's go. Let's jump in. Welcome to the Girls Talk Healthy Aging podcast, where we dive deep into pressing health and fitness issues facing aging women. I'm Allie Kerr.
And I'm Shauna Kaminsky.
And together we'll bring candid conversations, expert advice, and personal stories that will inspire and empower you on your own wellness journey. Because I think you are obviously interested in health and fitness and making an impact on your patients. You may not always feel like it, but they're listening. Some of them are listening, and they're telling me about it.
So. Well, we're very grateful for your program. It's highly motivating. I have a lot of, especially females, that really kind of got started. Feel a little intimidated in the big gyms. Need a little bit of encouragement. I mean, everybody needs encouragement, and depending on where you're starting from. I'm just a fitness fanatic. I mean, they're really, to me, there's almost no condition that warrants skipping the workout. So I do give the patients a hard time about that, but.
And we appreciate that.
Yes, but it makes them feel better. It improves their health so much. I mean, you can't do much about the genetics you're born with.
Absolutely.
But you can do a lot about your behavioral habits. And we love your little program. It's, like I said, it makes women feel safe. It makes them feel productive. They're getting it done. And then most of the time when people get some weight off, they get in shape, they feel good enough to continue it because they feel so much better.
Absolutely. They definitely feel better. And another one of the reasons I wanted to interview Dr. Vaughn is, of course, she's a physician who can give us a totally different, but she's also a fit physician. And she practices what she preaches about health and fitness, as well as, I'm sure, the health just in general. So I thought that was something that I wanted to talk with a physician who not only is just telling patients, well, yes, you need to exercise, but you're actually doing it yourself. So tell our listeners a little bit about how you got started in the fitness and just growing up and the influences that you had in fitness.
Well, my father was a marathoner, and so as a little girl, he would go to the track. I mean, as you know, running marathons, this takes a lot of time to train.
Yes.
So he would take us, myself and our dog, to the track, and I would just kind of run till I got tired, and he would run his training stuff, and so we just kind of got to where we ran together, and it was a family activity, and that's something I really emphasize to people. Your children are going to do what you do, not necessarily what you say, and so setting a good example for them is really the most important thing you can do. And so it's hard. I mean, it's getting dark more quickly in the winter. It's hard to make time. We're working, we're all busy, we're moms, everything else going on, but you've got to plan your day around your exercise instead of your exercise around your day, and because that's when it gets skipped.
Absolutely. So. That is good advice, and the doctor said it, so you have to listen. It is so true. We do so many times. We get busy, and then exercise is an afterthought, and we try to fit it in. And I want to hear more about what time of day that you exercise, but I get that question, like, what's the best time of day to exercise? And I tell clients, whenever you're going to do it is the best time of day to exercise. And so what works for you? You're a busy lady. You run a medical practice here, and you are a mom. So I know you've got to be super busy. How do you fit it in your day?
Well, I just try to map the day out. If I know I've got to be here at an unreasonably early hour, I'm not much of a morning exerciser, so I prefer to go in the afternoons. And sometimes I'll just slip out for an hour, hour and a half, and I have gotten to where I can shower, redress, and remake up in a 20-minute time span.
Wow.
So I'm quick with that, but I prefer to exercise in the afternoon where I'm kind of done with my day and I can kind of think it over, think the patients over, think what's going on over, and just clear my head. But that doesn't always work. And this week, 2 times I've had to go to the gym at 4:45 in the morning. But I really need that to kind of keep my day mentally clear and on track. And I think people miss that, they say, well, I'm too tired, or I'm this, or I'm that. But, really exercising makes you more productive. So, and it gives you energy, even though it takes energy. So really the payoff is greater, in the end by doing it. So I just try to map the week out, and anytime I can fit it in, that's when I do it.
And that's great. And it sounds like I call that a plan A and a plan B. So you like to go in the afternoons, but sometimes that's not going to work. So you have to go to plan B, which is 4:45 in the morning. But that's great that you're, making sure that you're getting it. Even if you can't do it in the afternoon, you're making time and you are mapping out your day. You're thinking ahead. Okay, I know I'm not going to be able to do it after work tomorrow. So how am I going to fit it in instead of getting busy and then saying, oh, I'm too tired, and I got this and I got that, and I can't do it. With you being a physician, and I know you're seeing men and women coming in every day and in all different stages of life and in all different places as far as their health and fitness, tell us something that you wish that patients understood more about their health.
Well, one thing I like to tell people is, there's not a pill for every ill. So,
not a pill for every ill.
That's right. So it's not everything needs to be medicated. And honestly, I'm here to guide their health care. But really, the patients themselves have more control over their health than anything I can do for them. So really, I try to empower them, by keeping their weight down, by using a fresh diet, I mean, it's easy to put in a TV dinner. It's easy to microwave it. I mean, and I'm a terrible cook. Everybody knows that. But, I try to pick up some fresh foods. I try to, eat better, eat healthy when I have the opportunity. It's a lot about food prep. I pack my lunch every day.
Wait, did y'all hear that? Did y'all hear that? She packs her lunch. When I had actually spoken with her through email before, and she was telling me that, and how amazing. Kudos to you. I have to give you a high five, Dr. Vaughn. That is amazing. So many people don't do that. Okay, so you pack your food every day. She's not going out and grabbing, and she's busy. And I mean, so many people that are doctors, dentists, they're telling me, oh, I'm so busy, patient to patient to patient, and I don't have time to eat. So.
Well, and even if I didn't, I don't go to the hospital, so I don't have the opportunity to eat there. I don't pass, there's just sort of fast food around here. But really, even the hospitals and the doctor's lounge and everywhere else, they're providing us with good choices. The big employers here, Geico, I've been to their lunchroom. It has salads, it has yogurts, it has fruits, it has lean meats. I mean, the choices are there. We've just got to get in the habit of making them.
Yes, wow. And what about us? Let's talk about moms, because you are a mom, and kids' activities. This is one of the things that I get a lot from moms. They're telling me how they're going through drive-thrus all the time because we've got to take the kids to ball and we've got to run here and we don't have time to eat. And what can we do as far as influencing our children and making sure that we're raising healthy children? What are some things we can do as moms or parents?
I'm like against fast food. You will never catch me at fast food.
I like you more and more, Dr. Vaughn. Yay!
But you can throw a cooler. I mean, not when it's 110 in the summer, but right now you can throw a cooler in your car and put those power packs of cheese and pre-cut meats and nuts, fruits, things like that. If you have that option available, then at least, your kids will choose that when they're with you. Now, you can't control, they're going to go out and eat donuts and yada, yada. But at least you won't have to worry about that, when they're with you. And then you'll have the good choices, too, so you won't be eating McDonald's because you're on the fly, too.
Right. And one of the things I know that we do live in a busy world, and we do our kids, I don't have kids, but I know that because I work with a lot of ladies that do, I know that is a thing that is taking people away from their home, or they're out and about during the day. And we look at those things as very big priorities as far as, our kids need to be involved in that and kids need to be involved in that. How much of a priority do you think, how much weight should we put on teaching our kids how to be healthy versus, being involved in these activities? How do we find a balance there?
Well, it's really hard. Life is all about balance, and if somebody finds a way to strike it everywhere, let me know, because I need to learn it.
Call us.
Exactly. We can all use some help with that. But what I see, of course, is the adult end of that. So I'm seeing these, young 20s, these late adolescents that didn't learn good health habits, and now they're suffering some of the consequences, So I really feel like it's important for you to set that as a high priority in your house. And I mean, don't think my kid doesn't eat Cheetos and donuts, because he definitely does. He loves donuts, and I love donuts, but there's a limit to how many donuts you can eat. So, it's a treat. And so we just really try to keep the good stuff with us and make that a priority. We don't eat out a lot. I mean, eating out is expensive. It's time consuming. With the way the food prep is now, Publix, Kroger, all these places, they've got steam in the bag vegetables. They've got, chicken that's already rotisseried. I mean, the choices are there, and it's quick and it's inexpensive. So,
so we have no excuses. Basically, that's what we're saying here. We have no excuses. What about the patients that you see coming in? I know you do, I'm sure you do annual exams, the annual physicals with patients. What do you typically see when you're comparing a patient year after year? Let's say a woman who comes to you starting in her, and I know you even mentioned people in their 20s, but maybe 30s and 40s, you know, they come this year and you check their weight and you check their blood work, and then they come back next year. What are typically the trends that you're seeing with weight and blood work over time?
Well, I mean, I think we're all getting, I tell all the patients we're not getting anything but shorter and wider.
Oh no!
We're shrinking
Yeah.
and our metabolisms are slowing down. And so you kind of have to fight it a little bit. And a lot of times patients will say to me, but I haven't made any changes in my diet at all. Well, that's the deal. You know, your metabolism is slowly coming down. You're losing muscle mass over time. You got to work harder. You got to add a few little weight-bearing exercises. I mean, you know that. You have to distribute the exercise. Now, I'm a cardio lover, so I hate doing weights. I'd much rather run, but I'm trying to salvage my joints. So I've started doing light hand weights, you know, light ankle weights. And you're the expert on the exercise, but, you know, diversity in exercise. But I notice a specific trend. I'll tell you something else. If you have a sedentary job, huge difference between patients that, you know, walk the floor, especially nursing staff, things like that, and sedentary jobs. So, you know, I tell people we use stand-up desks in all our rooms to keep us, and to kind of keep us fluid. I think sitting in one place for a long time just isn't good for you.
Absolutely, yeah. So what do you notice between the ones that are in the sedentary jobs versus the ones that are in the more moving around jobs? What kind of differences are you seeing?
Well, the main difference is when somebody goes from one to the other. So we'll see somebody that's been walking the floors and suddenly they're made to be a supervisor and they're sitting at a desk, they're going to pack on 5% extra. It's just every time. And they're miserable. And so, you know, they make all kinds of crazy stuff that's really awesome. Like these balls that you sit on where you kind of have to balance your torso instead of just a regular desk chair. I have a lab lady that works here who will wear ankle weights around during the day to help build muscle mass. I mean, there's a lot of little things you can do. I mean, it seems kind of silly, but, you know, that stuff adds up. And that's going to add, you know, 20% on your triglycerides. That's going to, you know, increase that blood pressure. The other thing I notice is how much stress we put on ourselves. And regularly I'll see people retire and they'll be on 11 medicines, 12 medicines, and one by one they'll start dropping them as their stress level goes down. And that just amazes me.
Wow.
We're wearing ourselves so thin with all these responsibilities and job stresses and everything else that we could require that many medicines.
Yeah, and one of the things that in our email conversations back and forth that really stuck out that you said to me is, you're oftentimes, not only can everything not be fixed with a pill, but you're oftentimes treating side effects of a medication with another medication. So talk to us about that.
Well, you know, I always tell people that for every action, there is a reaction. You know, that's obviously that's a science mantra from many years ago.
Yeah.
But that's it. I mean, you know, these medicines are not free. You know, they have a side effect, they have things that, you know, they cause, they have other side effects they cause, and sometimes I find myself chasing my tail, you know, chasing one side effect from one medicine, when really the whole disease state could be modified so well with a major diet and exercise change that we might not need any of them.
Did y'all hear that? The whole disease state could be modified or changed with the proper diet and exercise, and we wouldn't need any of those medicines. Wow, that's huge. And that's going to lead me to my next question. That may have kind of answered it. But what is one of the things, I know we all have our interactions with I know with me, with clients, there's certain things that I just wish that frustrate me, that people just don't understand, or that I feel like I'm beating a dead horse sometimes. What do you feel like is one of the most frustrating things being a physician?
Well, and I'll say this definitely for females, you know, we put everybody before ourselves. We don't make enough time for ourselves. And I try to remind people, you can't take care of your husband, your family, your children, your parents, or even for men, your wife, until you've cared for yourself. And so, you know, we've got to prioritize ourselves a little bit more. You know, 30, 40 minutes a day, you know, is really going to add later on. I mean, it's really important, but it's hard to do. I mean, I have a hard time doing it too. I feel like I got to make sure and check all the boxes for my kid before anything else gets done in the day. But, you know.
Yeah, and that is definitely something that I see too. It's just we as women, because I work mostly with women, and we do not take care of ourselves. We do take care of everybody else. And sometimes I think we feel guilty as women of doing something for ourselves, and unfortunately that's not helping our health. So what about for a lady who's in that 35 and older, let's say 35 and older range, if you could give them some just life-saving, life-changing tips what would you say are some things that they can do that would be life-changing, life-saving?
Well, I mean, really what we've talked about so far, you know, those early, I mean, you know, 30, of course, I'm 45, so 35, 35 seems early to me. Yep. So really set your habits. Make it a habit, just like brushing your teeth, exercising, reaching for the right foods, you know, minimizing the alcohol intake, you know, except in the holiday times or whenever. And just, you know, making the bad foods kind of a treat, you know, a special occasion. Because those health habits are going to set the tone for how you do in your 50s, 60s, and 70s. And I'll tell you, especially when I worked on the rehab floor at Coliseum, I could tell how a joint replacement patient was going to do, and I know the orthos will say the same thing, based on how their fitness and health is coming into the surgery. And so, you know, that's really huge. I mean, you can decrease your recovery and, you know, have such a better outcome by, you know, having those early health habits set.
Absolutely, yes. And I definitely see the joint issues too, and that's something that I think that is attributed to so many of the things that we talked about with being overweight and just sitting a lot, being sedentary. I see that that tends to lead to, in my what I see every day, that leads to more of those. So I'm glad you brought up the joint issues, because that's a biggie, because we might feel good mentally, but if our body's falling apart, it's not easy to exercise. What about exercise? And you know, a lot of people will tell me, well, I can't exercise because I have a bad knee. What would you, and you said, you know, you don't feel like there's a lot of reasons to not, so tell me how, I want to hear from the doctor here.
Well, you know, there's really no excuse. I mean, there's every kind of exercise. You know, there's 3 pools in town that are heated. You know, they have walking lanes. Because people always say, well, I can't swim. I said, well, it doesn't matter, because there is a lane that you can walk in. I mean, and really any physical therapist that's done any joint work with you, you know, or you can give them some advice on the best exercises. But I mean, even our knee replacements, I mean, they're going on bikes the day of, day after. I mean, you've got to stay mobile. And there is an exercise, if you have a lower body, you know, a lower extremity problem, exercise your upper body. But really the water is, you know, it's kind of the end of, that's how I close it up when I'm getting a lot of excuses, because, you know, there's just no time that's not appropriate for somebody. It's, you know, so easy on the joints.
Yes, so you can do something. Yeah, I joke with my clients and tell them if they're, you know, if they're not in a body cast, we can find something that they can work. And even then we may do eye blinks for exercise. So tell us one final thing. As far as if you could get one message to the masses, I know that, you know, health and fitness is a passion for you personally. You grew up with a father who's a marathoner, and now you're practicing medicine, seeing patients every day. If you could get that one message, one thing out before, you always have those things, before I die, if I could get this one thing across, what would it be? So what would that be for you?
That's a good question. There's a lot of things that come to mind immediately.
You can share more than one.
I think probably just 5 days a week, 40 minutes of exercise, you know, fresh fruits and vegetables, 5-6 servings a day, you know, no sodas, no, you know, all these sugared, carbonated beverages that we're drinking, you know, 5 to 7 glasses of water every day. I mean, just, you know, really it's the stuff you already know. It's just making the time to do it.
Yeah, and you said planning ahead, so great. Well, thank you so much. I'm so thankful that you took the time out of your busy schedule to get in exercise, work all day, and do this interview. So we really appreciate that. And I just wanted to let people out there know, if they want to find out more about Dr. Vaughn, where would they go?
Well, we have a website. We have a Facebook site that's Vineville Internal Medicine, and then, of course, we have a website that's vinevilleinternalmedicine.com. And you know, we're happy to take questions and anything else we can do to help people, and we really appreciate people like you that help us help the patients.
Wow, Allie, so many takeaways from that interview. If you were to leave our audience with one wish, what would it be?
My wish is that somebody out there will take this and do something to get off of a medication.
Yeah, that's a big one. Yeah, similarly, also, I would just like for listeners to even take one step. I think the problem is sometimes, you know, there's so many steps. It's like, oh, I need to do this, and then you end up doing nothing. Yep. So rather than, yes, create the list of things that have to be done, but just take one small step. That's my wish.
Love it. Thanks for listening. You'll find me, Allie, on Instagram at Allie Curve Fitness.
And you'll find me, Shauna, on Instagram at Shauna Kaminsky. Feel free to pop us a DM with questions and or feedback.
Until next time, be healthy and be happy.